I'm calling from the traditional, ancestral, and unceded territory of the Kitty Nation. And I'm here in my capacity as Executive Director and Staff Lawyer for Seniors First BC. And like others, I would not be able to do this presentation without the work of my team. And I would like to acknowledge in particular Tina Cheng, who is the Senior Abuse and Information Line and Victim Services Manager. And she's in the attendance. So what I was asked for my presentation is to provide some empirical data and some statistics. Just before that, I will give you some contextual background as to who we are. So Seniors First BC is a BC-wide organization that aims to empower older adults to live with dignity, autonomy, and safety through information and education. We also promote access to justice. We provide emotional support, advocacy, and referrals internally and to other agencies. We collaborate with government and community agencies, and we promote and facilitate law reform. So we have various services. I won't go into too much depth into those. Most of the statistics presented today are from our Seniors Abuse and Information Line, which most of you probably know, also referred to as SAIL. We have also other services such as the Victim Services Service, legal services, and public education outreach program. SAIL provides emotional support, but not counseling, information referral and intakes. And our workers identify risk factors and provide brief safety planning when the circumstances requires them. And now I'm going to talk about the calls that we have received from a time period spanning from February 2019 until I believe it's March 2022. To better understand those statistics, we have organized the calls here by region. This is because most of SAIL funding is from the Ministry of Health, and we therefore provide them statistics by region identified by health authority. Like you see, most of our calls come from the Lower Mainland, then from Vancouver Island, Interior Health, and Northern BC. In red here, you can see all of the calls, all of the interactions, rather, I should say, made with SAIL, and in blue, all of the abuse-related calls. And highlighted in yellow are the COVID-19 waves. There is some interpretation as to the timing of those waves. So this is the best effort I made as to what were the most consistent dates. So as you see, during that time period, again, from February 2019 to March 2022, SAIL interacted with over 18,000 clients, and about 6,000 of those interactions were for calls where there was an allegation of abuse. The way to understand those stats is that first, like many other agencies, we struggled to adapt to working remotely. Our telephony system wasn't necessarily performant at the time. So when the state of emergency was declared, you see that there was an increase in the number of calls, but then a drop in October when staff worked remotely. So it is not an indication that calls had dropped. We believe that calls continue to increase, but unfortunately, we're not able to meet the needs of the clients who try to reach out to us. What is interesting to see, however, is that even when the calls dropped, the number of abuse-related calls continued to increase. And therefore, we believe that those numbers would have been much higher if we had been able to meet the caller's needs immediately. And that's really unfortunate. It's something that I needed to mention to better understand the context of those statistics. So here's the trend in, sorry, I'm just going to, here we go. In abuse-related calls, like you see, there's been a really high increase in abuse-related calls over the past few years. Sorry. Ooh. And like Gloria said, emotional and psychological abuse and financial abuse are some of the most commonly reported types of abuse. We saw a steep increase of emotional and psychological abuse-related calls when the state of emergency was declared, because again, like Gloria said and others, whenever there's a change of people's routine, it creates a lot of stress for them, and people were at a loss as to what to do. It was an extremely stressful time. And then we see a steep increase in financial abuse related calls. I will dig more into the statistics shortly. Oh, sorry. So here's the evolution of harms during COVID. So we noticed that there was a large amount of calls related to emotional abuse when during the confinement and when vaccines were not available. So calls related to physical abuse also increased. The way you can see the statistics is in blue are the pre-COVID statistics. And then it's by a 13 months period, because we try to have as many statistics as we could. So you can see that in April 2021 to April 2022, there was an increase of 70% of calls pertinent to physical abuse compared to pre-COVID. But generally, all types of abuse-related calls increase. Emotional and physical and psychological abuse is always the first type of abuse reported. We saw a steep increase in financial abuse. And you see here 600% increase compared to pre-COVID of criminal-related calls, and 668% when it comes to self-neglect. And that is because people were so isolated. When we look at the relationship between the older adult with their alleged abuser, like others have said, it's mostly a family member or relative, and then it's people whom the older adult resides with. So whether it's a healthcare professional, patient resident, and also those who provide housing to them. We noticed an exponential increase in calls related to issues related to people's housing, issues with their landlord, or after people lost their house. There's a housing crisis in BC, and many of them became homeless, unfortunately. And this is seen in those statistics. When we look at the older adults' housing, most of them live independently, but we can see that there was a great increase in calls from hospital and from people who are homeless. And obviously, because many homeless people do not have access to a phone, we can imagine that those calls would be much higher if people were able to reach us. So now we come to the analysis of the risk factors. So between 2020 and 2021, the majority of callers identified, as we said, the alleged abuser as a family member, and oftentimes it is their adult children. When it comes to financial abuse, the second most common type of abuse reported to us, it is regarding often children, but others exploiting the affected adult for shelter, pressuring them for money or to change their will, and for property disputes. And we'll go over some examples afterwards. At the beginning of the pandemic, callers expressed needing urgent help with basic needs, so housing, financial assistance, and mental health related concerns, whether it's for them because they were so affected and under high stress, or because they had to deal with the stress of their relatives and of their children, sometimes who came to live with them, because the housing crisis affected obviously not only our clients, but also their children and their relatives who often had to live with them. As the restrictions lifted, the community returned to a new normal. Calls increased, and particularly calls related to abuse. The cause of the increase, we think, is due to their ability to call us and to reach out safely, whether it's to call us directly or to reach out by email or via other community agencies. Therefore, the risk factors for abuse that we have identified are the local economy, having low housing security, and obviously isolation. So these are some sale narratives. In other words, these are anonymous summaries of calls made to our senior abuse and information line. When it comes to emotional and financial abuse, this is an example. So the older adult's grandson lives with her. So the older adult, it's someone who has mental health and substance use issues. The older adult doesn't know how to handle it. And she reported to us that she overheard a discussion between her grandson and her daughter, where they were planning to have her deemed not capable to try to take ownership of her home. And unfortunately, these calls are more frequent than we would like to. When it comes to physical abuse, we had a number of calls from concerned family members stating that their parent or that their spouse had been physically abused by another resident or staff member. Sometimes the mother has dementia, which obviously affects their credibility and makes it even more stressful for them. And the institution didn't seem to take any step to address it. And that's when the sale worker would make a referral to our victim services and also to our elder law clinic. Since I'm talking about the elder law clinic, I thought it was important to mention the trends in the issues that came to our legal programs. So when it comes to financial abuse, there's this case where a caller hadn't been visiting her parents as often as she wanted because of concerns due to COVID and making them sick. When she returned home, she noticed that her father was hiding in the bathroom when she was there, having secret conversations on the phone about making a good investment. And later on, she realized that most of her parents' life savings had disappeared because of a scam. And oftentimes it's too late. When that happens, we can take preventative measures to ensure it doesn't happen. We have outreach programs to discuss how to avoid fraud and scams, but when it has happened and the money has left the country, it's very difficult for us to help those clients. This is another example where a client transferred her house over to her son with the understanding that he would take care of her for the remainder of her lifetime. So she had transferred title and kept a life interest in the property. A few months later, he served her with an eviction notice, which didn't make sense because it wasn't a tenancy agreement, but it really showed the increase in fraudulent conveyances and attempts to abuse financially the older adults and exploit them for shelter. When it comes to negligence and health law, here are some other examples. Here's a client's wife who had dementia. She was in a residential care home, and he realized that his wife hadn't been outside and be able to take some fresh air. She appeared to be over-medicated, and while she was quite mobile in the past, she had lost a lot of her mobility because she wasn't walking outside anymore. So now she required a walker. So in those instances, rather than going through legal action, we first try to mediate the situation and see if we can improve the conditions under which the residents are, and for all of them and not just this person. But unfortunately, again, this is something that happens when this is reported to us. What the facility often tells us is that they are understaffed and not able to ensure that walks are made in small groups. And it's the type of excuses that we hear often, but in our opinion, that cannot be justified. Another example, the caller reported that his mother's assisted living facility had been neglecting his mother. Again, he hadn't been visiting his mother for several months. When the visitation rules were eased, he noticed that there was rotten food in her fridge that he had given to us in the summer, and that was months later. So some of the risk factors that we notice are isolation, income security, physical and mental health issues. So I wanted to leave some time for questions, but these are basically most of the data that I was able to provide for my presentation. Thank you.